you're gonna remember what I said about saving this piece of paper. You might as well put holes in it and put it somewhere like in your clinical folder and say, what did Stacy say? How am I supposed to do this kind of thing? This is what's gonna help you, okay? So the next part, we are still in nursing diagnosis. So this is a huge piece. We're still in that chapter. So now you have a list of potential problems. You all should have a list, and some of you may have 5 or 6, some of you may have 15. It doesn't mean that we're going to do a care plan on 15 nursing diagnoses. What we're going to do next is we're going to prioritize these nursing diagnoses based off of what we do know about this patient. And how are we going to prioritize? You've heard this before, the words prioritize. Maslow's hierarchy of needs, okay? And then the other thing that's in your book, it talks about classifying as high, intermediate, or low importance. High being is you think of it as if it goes untreated, it could result in harm to a patient or others. So let's talk about that for a minute. Pain versus knowledge deficit. Which one goes higher? Pain. Okay, do you see this?
And if a patient's in a great deal of pain, you can't educate
right.
them until you get that pain under control.
Right. So those are pieces when you're prioritizing, when you're out there on the floor as a nurse, patient may have a knowledge deficit, and I remember Michelle talking about that. They're in pain, guess what? Looking at Maslow's, looking at this high, intermediate, low, you're going to address the pain, okay? So intermediate involves non-emergent life-threatening needs as the patient, and low, not always related to the direct illness or prognosis, but may affect a patient's well-being. So that could be something like caregiver stress or something along those lines. Patients getting ready to go home with a family member. We might prioritize that lower. Doesn't mean it's not important, but we are going to address it later. Okay? All right? So what we're going to do is we are going to flip to the next page, okay, and we're going to talk and we're going to work on prioritizing the ones that you already have on your list. You may have to go back and forth to the other page. I want you to go through your list and underline your nursing diagnosis that you just made when you did your problem list. What are the most important nursing diagnoses that you guys listed? What do you think? Okay, so spend a minute going through. Actually flip back to page 4, where you were just listing, and go through your list and kind of do an asterisk or a rating system. Which ones do you think are most important for your patient, for this case study that we have right here? Okay, does everybody get that? All right, and then I'm going to tell you what you're going to do. So kind of go back through, and then we're going to talk about those and see which ones you think are most important, and use your high, intermediate, low, and use Maslow's, okay, to help you figure that out, okay?